Hey, I'm Dr. Dino Pappas with the Rosti Rehab Centers in Northwest Hills, Austin, Texas. Today is a Research Friday vlog. This vlog is going to be on this recent study that came out called EXPOS, which stands for Extremity Pain of Spinal Source. So researchers trying to look at the question, trying to answer the question of how much of the pain that we're seeing in the extremity is really sourced from the spine, is coming from a spinal source. This is kind of an important question in the field of rehabilitation and rehabilitation medicine, because there's an overlap between what's going on in the extremities and what's being referred from the spine. So they try to answer that question, and this is kind of a unique thing that they've done. So there's about 322 participants in the study at a good sample size. And what they found through repeated motion testing, aka using some of the McKenzie protocols of repeated movement assessment, was that they found 182 patients of that actually had true extremity pain. Pain was being primary source from the extremity, whereas about 140 of the participants actually through repeated motion testing actually had a spinal source for their pain. So it was approximately about 43.5% of the subjects in the study actually had something in the periphery that was sourced from the spine. Of importance to note was the hip itself, where about 71% of the candidates in the study actually had pain from a spinal source. Approximately about 13 with pain in the thigh had a spinal referral. And then in the arm, the upper arm, not the shoulder itself, but in the upper arm, approximately about 83% of the candidates that they had pain located there was sourced from the spine. So moral of the story is it is something for us to pay attention to in our assessment, in our diagnosis, and in our treatments. If we're treating locally and we're not getting the response, flip the script and start evaluating the spine. Let me just give you a general overview of what's worked for me over the course of the years. This is obviously something I try to refine, but some key questions would be a history. Do you have a current history of spinal pain? Any spinal pain in conjunction to your extremity problem? That's an important question to help us think that maybe the source of the problem is spine related rather than extremity related. Second thing, maybe they don't have current spinal pain, but maybe they have past episodes, debilitating episodes, singular or plural, of spinal pain. If we see that in the history, it is possible this thing could be rearing its ugly head and causing extremity pain currently. So that's another important question in the history to ask. Any spinal range of motion loss. It's a real quick assessment to see if they've lost flexion, extension, rotation, lateral flexion. If there's a major motion limitation in the spine and it's more than what their normal is, then again, a flag goes up. Maybe this could be a problem that's spine related rather than extremity related. Using your testing clusters, there's some excellent testing clusters that have come out that are being refined that help us think maybe the spine is the source of the problem. The one that I'm going to reference is cervical referral into the shoulder and into the arm with the arm squeeze test. If there's more pain closer to the elbow with the arm squeeze test, higher chance that this is being referred from the cervical spine versus the shoulder itself. Whereas if you squeeze around the shoulder and there's more pain closer to the shoulder, more likely than not, this is shoulder source pain. And the other one is called the cluster of Wenier. This is a testing cluster that involves cervical compression, cervical lateral flexion and compression, cervical rotation and extension with compression, and then cervical distraction. If multiple of those are positive, it is more likely that pain referred into the upper arm is spinal source rather than shoulder source. So again, there are some testing clusters. I just demonstrated 2 testing clusters with the arm squeeze and then with the cluster of Wenier. And the last thing, if you have some McKenzie method training, really the magic I found with that is the assessment process, the thinking through the problem. A repeated motion or sustained motion testing is one of the best orthopedic tests that we have to let us know there's a good chance that this could be spinal related, or no, it's not spinal related, this is extremity related. Cervical retraction and extension, repeated lateral flexion, rotation, whatever you find on your assessment. It doesn't necessarily have to be flexion or extension sagittal movements, but if we start to see improvement in cervical motion, distal reports start to clear on up, pain starts to centralize towards the neck, it lets us know that the spine is involved. All right, so I'm Dr. Dino Pappas, again, Expos, EXPOSS is the name of the study. It lets us know, let's be open and willing to the possibilities that extremity source pain could be of spinal source.